Hi guys, welcome to Maternity Me. I'm Faria and today we're going to talk about 6 things you should know before trying for a baby. If you haven't already, go ahead and watch the first part of this video where we talk about what preconception health is, why it's important, and why you should make the effort to achieve a healthy BMI before becoming pregnant. So just a quick reminder, the idea behind preconception health is that a couple that's healthy at the time of becoming pregnant is more likely to have a safer pregnancy and a healthy child. And there are several things you can do for good preconception health. And in this video, we'll be talking about some of them. And with that, let's get started. Number 1, folic acid. Now, I'm not going to go into too much detail right now because the next video is going to be on nutrition and supplements. But the main point I like to make is that as soon as you can, start taking a vitamin called folic acid. All women of reproductive age are advised to consume 0.4 milligrams or 400 micrograms of folic acid daily to prevent the risk of serious birth defects. And most women choose to meet this requirement through a daily tablet. And ideally, we would like women to be taking folic acid for at least 3 months before they become pregnant. Number 2, try to stop drinking, smoking, and cut your caffeine intake. It's common knowledge to avoid alcohol once you are pregnant, but there are many benefits in stopping drinking beforehand also, as you might not know you're pregnant until several weeks in. In addition, these factors can also affect your ability to become pregnant. And like with alcohol, it's unclear how much is needed to have a negative effect, which is why the guidelines recommend to stop drinking alcohol altogether and reduce your caffeine intake to about 200 milligrams of caffeine per day, which is about 1 medium-sized cup of coffee. Stopping drinking or smoking can be harder for some more than others, so don't get disheartened if you're finding it tough. And please know that your doctor is here to help without judgment and can refer you to local support groups or offer other options. And one great resource we recommend for quitting smoking is a smoke-free government website or app. It even has a section for pregnancy and motherhood and has great features like a text messaging program and telling you how much money you've saved. Number 3, talk to your GP about any antidepressants or epilepsy medications that you're on. If you have epilepsy, we recommend you see a specialist to talk about the different options available to you. This is especially important if you're on a drug called sodium valproate, which isn't just a medication for epilepsy, but also bipolar disorder. Different factors like type and dose can affect the risk of complications, particularly the risk of complications during brain development. If you're on any of these medications, we recommend you see a doctor before you're pregnant to minimize any anxiety surrounding changing medications later on. But I cannot stress the importance of this next point. Please do not stop taking any medications without consulting a doctor beforehand. Which brings me to my next point. Number 4, talk to your GP about any pre-existing medical conditions or previous pregnancy complications. Some conditions and medications can affect your pregnancy or fertility. Diabetes, for example, should be well controlled to minimize the risk of complications to you and your baby. You can also talk about any medications that you're on and if anything needs to be changed. For example, if you're on metformin for your diabetes, this is considered to be safe during pregnancy, but there may be other medications that need to be addressed. It's also very important to discuss any previous pregnancies you've had and if you've experienced any complications to ensure that you get personalised care before and during your pregnancy. Number 5, check that your vaccinations are up to date. Vaccines protect you against infections, and some infections can put your baby at risk. You can talk to your doctor about what vaccines you might need. One example of this is the MMR vaccine that protects you against 3 types of infections: measles, mumps and rubella. If you aren't fully vaccinated or there's no record available, getting vaccinated can be easily arranged. And if you do get vaccinated, you should wait about a month before trying to get pregnant. The last point I'd like to make is that preconception health is not only important for the mother, but for the biological father also, which is actually quite nice because you might be more motivated to keep up with the healthy lifestyle if you know you're not in it alone. Firstly, sperm count and quality can be affected by numerous things, such as smoking, heavy drinking, recreational drugs, and more. And so if you didn't have the motivation to stop habits like these before, this might be the motivation you need. And this is important because by improving your sperm count and quality, you can improve your chances of becoming pregnant and minimize the risk of developmental complications. So when should you start making these lifestyle changes? Well, since it takes about 72 days for sperm to develop and mature, it's good for lifestyle changes to take place well in advance, ideally at least 2 months before trying for a baby. So in summary, here's what we recommend. 1. Start taking folic acid daily as soon as you can. 2. Try to stop drinking, smoking and cut down your caffeine intake. 3. Talk to your GP about certain medications. 4. Talk to your GP about any pre-existing medical conditions or previous pregnancy complications. 5. Check that you're up to date on your vaccinations. And 6. The lifestyle of the biological father matters as well. Thanks for watching. If you found this video on preconception health useful, please remember to like, comment and subscribe.